So, dear friends, today we will be discussing a very important topic, and we are in the session of Scienxt journals. This journal which we try to help new and seasoned scientists to publish their research, do the public awareness, and overall we try to help the community on the scientific level. So our intention is to convert the science into the public health or helping the community. So with this same intention, thanks to Mamta and the Scienxt journals team, Dr. Shashikant Pattan, today we will be discussing on very important topic. So I am waiting for the 3.2 hit at the clock, and then we'll start. So today's topic is little weird. It's fertility health and how to evaluate our fertility potential. So we'll be talking on that. I'll wait for 3 o'clock. I think we have a lot of people joining. So our session will go on from 3 to 4 p.m. We will try to tackle a few things regarding our general health and fertility health. So yeah guys, it's 3 p.m. In the monsoon, and right now I'm talking to you from Nagpur. So it's full of rains, maybe bad internet connectivity. So bear with me, and I hope to reach out to all of you. So again, I repeat the topic today. Welcome back, and welcome to today's topic of how to evaluate my fertility potential. This is the word which is now people are getting aware of. Like there is something called as a fertility and a fertility potential. So before we go into like really how do we evaluate fertility potential, we need to talk about it, why we really need to do this. So guys, you all know we are all in the era of talking about being healthy. I think this was not the case 20 years back. When I had left India, it was not the case. I didn't find a lot of obese people, but when I came back, there's a lot of obesity, health problems. We Indians are home to a very expensive diseases like heart attacks and diabetes, and hypertension is now housebound. It is there in every single family, and we are very casual about it. But that is the precursor and the first point to put us into a big dangers. So being healthy is very important, and we are all getting aware of it after we have crossed this and becoming unhealthy population basically. And to the extent that all the health businesses, the gyms, the diets, fat diets, the low calorie diets, nutritionists, dietitians, everybody has, all these businesses have mushroomed up, which was actually not needed to being healthy. But so we are in that area where all these businesses are helping us actually to becoming healthy. But I think if we take charge of our health, we need not need any businesses to make money and make us healthy. So today my efforts will be the same, like to take charge of our health. But it is a little different health. It is a fertility health which I am going to talk about. And in Hindi we would call it Prajanan Kshamata. And why do we really need to talk about it? Because at the same time, when we are spoiling our general health does have an effect on our fertility health, like how fertile I am. We being in Indian society, it is a big question that how fertile I am as a woman or as a man. That if I get married and try to procreate or try to have children, will I be able to conceive in time, or will I need any fertility treatments, expensive IVFs and so on. So it is very essential for us to know that how fertile I am. My effort is to teach you today about the same thing, that how I can judge, how we can judge how fertile I am, and if at all we come to know, then what we should do. So, talking to the definition of fertility, it is my potential to procreate naturally. Now, it's a natural process. Being fertile, getting pregnant, having a baby, it should be a natural process. So, procreating naturally is my fertility health, and if I am not able to procreate naturally, then I become infertile, or I am suffering from some other reasons which actually are interfering in my fertility potential. Why we need to talk about this? Being in an Indian society, we know how much importance it is of childbearing. So far we have seen childbearing is a cross which is being carried by the women, but now there is a little awareness among men. It's not something which is a gender specific. Both men and women are affected equally. Basically 30% when infertility causes are there, that is because of the both population, both genders, men and women are equally responsible. Only 20% are just because of women, 30% are common. It is because of both the genders. So that's why we are here to talk about fertility and infertility. What is the incidence of infertility in India? It is huge. It's counted in 2 years back is around 10 to 14%, and when we talk 10 to 14% in Indian context, it's almost 30 lakh people today are taking treatment or suffering from infertility in one or the other way, and they are consulting their doctors. Maybe it is maybe Ayurvedic, homeopathy, some friends, some advisors, some religious gurus. So this is a huge number. People are going through the emotional turmoil. Social stigma has not left us yet. So it's a big number when people are actually suffering from infertility. And out of that, almost 40% is because of the lifestyle change. So look at this, guys. It is a huge number. The 40% is a big number and that 40% is because of our lifestyle. And if we are able to change our lifestyle, if we are able to take charge of our health, it would be a great thing. And I believe if we tackle this life and lifestyle issues regarding infertility, then more than 50% people would not even need IVF. Me being a IVF specialist, I am telling you this because my intention is that many people should not need IVF and they should be able to procreate naturally. So let us talk about how is this our fertility and what are those factors which affects my fertility. So there are many things, like married couples, what is their frequency of intercourse. The study is there that if the frequency is too small, less or too much also does not help. So if the frequency of intercourse is once a week, then in 1 year time around the fertility potential is around 17% people will be pregnant. But if it is twice or thrice a week, then the fertility potential goes to around 20-24% in 1 year time. At the same time, the timing of intercourse is very important. So in the woman's menstrual cycle, when she is ovulating in the mid cycle, starting from 10th to 18th day, that's the time basically when the intercourse should happen. So timing of intercourse, there are so many tests which are available nowadays, like testing your ovulation potential. There are LH kits which come, which test how much is the LH hormone. You need not do that, guys. Just maintaining this simple frequency of intercourse of alternate day in that ovulatory period should be good enough, because a lot of stress adds up. As it is, we are in the stressful life situation. So just maintaining the normal intercourse, not to check with the LH kit, but yes, you can do that. There are things which are available. So this is about the timing of ovulation, and then I'm going to talk about infections. A lot of infections now. Our urbanization of our thought process and all, where a lot of abortions, multiple abortions which are being there, They are responsible, surgical abortions, unsafe abortions, they are responsible for a lot of infections, pelvic inflammatory diseases, and which results in huge infertility situation later on. At the same time, availability and usage of emergency contraception, it affects our ovulation in the future. So these things, girls and boys, should be used very judicially. That means, see here again I'm talking, your lifestyle should be really good and wisely decided. Then we will talk about, so what are these those infections which comes? I spoke PID, then there are sexually transmitted diseases, history of mumps in the childhood in men's, they cause infection in the testes and scrotum, which again leads to sperm functioning, reduction in the sperm quality and quantity, tuberculosis, leprosy, rubella. All these infections do are very significant and thus causes infertility. So if we are healthy and hygienic, and if we avoid all these infections, yes, we can tackle the infertility at the base level. Coming to the age, this is a big huge factor which affects our infertility. It cannot be denied, and I get a lot of surprises when I talk to people, or when I entered India after 15 years of my outside practice of infertility. I was very surprised. The learned people from the IT backgrounds and a lot of educated people were not even aware of age, or my age, wherein I am going to be infertile. So guys, here it is, and I try to spread a lot of awareness regarding that. So this, my fertility is a gift, we all know, but dear friends, don't forget, this gift comes with an expiry date. Now what is that expiry date? Yes, in women, we women all over the planet are born with a limited number of eggs when we are in our mother's womb. So we get around few lakhs. When we are actually at the level of puberty, we get around 2 to 5 lakhs eggs. So imagine that number is very small, and then we actually are spending those eggs over a period of time, starting from puberty till the menopause. And what does that mean? That means we have a limited stock of eggs, and that is reducing. That's the reason the best reproductive age for the female is 20 to 25 years. It sounds quite ridiculous coming from a gynecologist, that when I say you must plan your pregnancy by 25 or by 30, nowadays it's not possible in today's world. So this is again adding to the huge burden of the infertility and IVF budget, basically, because we, as our today's lifestyle, again that is the aspect of the lifestyle, when we are planning our career, focusing on the profession, and then simply the marriages are postponed. If after the marriage even the childbearing is postponed, so this age really is causing a problem. What we should do about it? There is a way. There is definitely a way, and I'm going to come across it and talk about it when I tell you how to assess my potential. So this is one. Lifestyle, as we said, we spoke about obesity, but obesity, whatever we speak, is less, because that is a biggest factor. 40% of my patients walking into the fertility center are obese, and they suffer because of obesity. Is a polycystic ovarian disease. This is a PCOD. Many of you might have heard, and it has a huge